We have, in the field of stroke prevention and atrial fibrillation, or for that matter atrial fibrillation management, a lot of data from randomized controlled trials. One of the issues about the trials is many skeptics sometimes say, how representative are those trials of real-life clinical practice? And just to give an example, if you turn the clock back 2 decades ago, when the first trials of stroke prevention and atrial fibrillation were performed, where warfarin was compared to placebo control, in those trials, less than 10% of the patients who were screened were actually entered into those trials. In that sense, the representativeness of those trial populations, and furthermore, in those trials, many risk factors, for example, of stroke, were not very well recorded nor consistently defined. What's the solution? Look at registries of real-life data where you can actually get comprehensive information on what's actually happening in the real world. Real-life registries have provided tremendous amount of information on what are risk factors for stroke and also the proportions of patients getting particular drugs for the management of atrial fibrillation. And those registries have in fact informed the development of many risk scores, for example, for stroke prevention in atrial fibrillation that have changed our practice. Scores such as the CHADS-VASc score and the HAS-BLED score, both of which now are recommended in the 2012 focus update of the ESC atrial fibrillation guideline. And on that note, this is a major event, major highlight of the ESC meeting in Munich this year, with the launch of the focus update guideline and its publication.